Good evening, I'm Ton Trump.
And I'm Natalie Shepard. The FDA is looking into an infection that patients in the U.S. seem to have acquired after undergoing open heart surgery.
And here in New Orleans, Children's Hospital is seeing the infection show up in a dozen of its young heart patients. Medical reporter Meg Ferris explains how it may have been spread.
12 children are being treated tonight in Children's Hospital for an infection they acquired from a machine used during their open heart surgery. The Stockert 3T heater cooler is used to cool the patients when the heart is stopped and being repaired. Then it warms the patients when the heart begins to beat again. Doctors at Children's first noticed 4 patients whose chest incisions were infected. That prompted immediate and vigilant surveillance to find any other patients who the machine was used on in June and July.
This is a difficult thing to watch. You know, it's heartbreaking as a physician to see these families go through this, because it's not only the patient, it's their entire family.
Children's Hospital sent out 55 letters to patients who potentially could have been infected. While Children's Hospital used filtered water on all these patients, some time ago tap water was used. And the theory is that even with the enhanced cleaning of the machine recommended by the FDA, this germ from the tap water was not killed. And then it was spread from the machine as a fine mist in the OR, contaminating the surgical site.
It's a bug that's a normal contaminant of soil, water, and dust. It's often found in municipal water systems, particularly in the coastal U.S. It's a contaminant, but it's not harmful if you drink it in low quantities.
In other hospitals in the U.S., patients have died from this non-tuberculosis microbacteria, a serious infection that's treatable, requiring intensive wound care and antibiotics. The treatment can go on for quite some time. But here in New Orleans, the prognoses look better.
Our patients are responding to treatment. No one is in imminent danger at this point that we can tell.
Children's Hospital has taken this machine out of service, and with the new machine made by a different company, they've gone beyond the manufacturer's recommendations for cleaning, and they're only using sterile water in it.
We owe it to them to do the best we can to put it right for them and try and keep this from happening ever again in another child.
Meg Ferris, Eyewitness News, Medical Watch.
Affected families will not have any additional out-of-pocket expenses for the treatment.